This meeting is being recorded.
A very warm welcome to one and all. Welcome back to the today's session. Today we have our guest speaker, Dr. MAZHERUNNISA Begum ma'am, professor from Department of Gynecology and Obstetrics from UNANI stream. Ma'am is from HMS UNANI Medical College, Karnataka. We welcome you, ma'am. We welcome all the participants. The session is all yours, ma'am. Please continue. Yes, ma'am.
Thanks for a warm welcome. Here myself will today discuss on the topic of PCOD. Hope many of you are aware of the disease PCOD. PCOD is the very what I should say very widespread disease these days in all the gynecological practice. As per the PCOD, earlier it used to be PCOD means polycystic ovarian disorder, and before that it was polycystic ovarian syndrome. Right now, two entities run under the topic of polycystic ovaries. Whenever we see a report like polycystic ovaries in a scan, we need to think of two things in our mind. One is polycystic ovarian disease, another is polycystic ovarian syndrome. Prevalence of both these diseases are very high these days, and both are multifactorial. But when compared to PCOD and PCOS is more dreadful problem or more difficultly treatable problem when compared to PCOD. PCOD is a polycystic ovarian disease wherein both are multifactorial, many factors come into play, and incidence and prevalence of both of these diseases is more and more overall over the globe, as well as in India, as well as in developing countries. So here today we'll be discussing more about PCOD. And PCOD and PCOS has a very linear difference. That linear difference is nothing but in the treatment part, both are different. But approximately causes and all are approximately same. Only thing is PCOS is an aggravated problem where endocrinology also plays a major role. Whereas when we say PCOD, endocrinology plays a little role, and it can be treated easily with diet modification, with lifestyle modification and all. But when compared to PCOS, we need a detailed treatment for that, a bit higher treatment for PCOS when compared to PCOD. Coming to the this is UNANI concept, so I'll skip this part because it is not so understandable to everybody. Anyways, I'll come to this slide at the end when discussing with the treatment, UNANI treatment. Commonly, PCOS or PCOD can be defined as, clinically it can be diagnosed or defined as any of the two. Like one can be any kind of menstrual irregularity added on with a scanning report showing polycystic ovaries. Or sometimes it can be with androgen excess symptoms like unwanted hairs or pimples, acne, hair loss, stress, anxiety, all those disorders, along with scanning report showing polycystic ovaries. So clinically, either of the thing will be present. Anyways, if we go deep into it, many theories have been postulated, but these theories are not so well accepted. Anyways, these theories are there, it's there. Coming to causes or pathophysiology. Either it is Unani, homeopathy, or any other stream, human body is same. So pathophysiology will be same, hormones will be same. Only thing is their interaction with the medicines will be different. Okay. So coming to causes and pathology. Causes can be hypothalamic or pituitary. Hypothalamic or pituitary compartment plays a role. Androgen excess will play a role. And ovulation will play a role. Obesity as well as insulin resistance play a role. And along with that, we need to discuss regarding the prolonged sequelae, like prognosis, what we say, or complications, what we say, that we need to be discussed. So here, when we say hypothalamic or pituitary compartment, how it plays a role in causing of PCOD, PCOD or PCOS. The main problem is hypothalamic pituitary gonadotropin releasing hormone. It has more preference towards luteinizing hormone, that is LH, and less towards FSH. So when there is PCOD, there is much of or excessive LH will be there and decreased FSH will be there often. And why is it so? This is because of preference of GnRH towards LH and decrease towards FSH, as well as a positive feedback of increased estrogen towards LH, which goes on increasing LH, and a negative feedback towards FSH, which will go on decreasing FSH. As a result, there will be an increased LH-FSH ratio, and this LH-FSH ratio inversion or increase will lead to PCOS or androgenic environment in the ovary, which will lead to anovulation and the same sequelae which we'll be seeing, all the symptoms and all which we'll see in PCOD. Next role can be because of androgens. Androgen excess can be because of ovaries, adrenals, or systemic metabolic alteration. From ovaries, theca cells of ovary will be secreting much of androgens, and this is because of result of LH, which is more. This increased LH level will stimulate ovaries, theca cells of ovary to secrete much of androgens. And adrenals, once again, adrenals will also secrete the as usual. Adrenals will secrete androgens. These androgens will be because of stress or because of hyperfunction of the hormone which is involved in the conversion of or in the formation of estrogen from testosterone. So this hormone will be more. That will lead to, that hormone is nothing but P250 C17. This hormone which will cause increased secretion or increased conversion of testosterone to estrogens. And along with that, when there is hyperfunction, when there is more or excess of LH, there will be excess of prolactin also often. And this excessive prolactin also stimulate adrenals to secrete testosterone. So in a nutshell, with ovaries, with adrenals, there will be excessive androgens, which will lead to androgenic environment of the ovary, which is the main pathology in the PCOD. And along with that, systemic metabolic alteration will also lead to excessive androgens. Systemic metabolic is in alteration is nothing but involvement of in hyperinsulin and hyperprolactinemia. Hyperprolactinemia, as we have discussed in case of adrenals. Along with that, it will cause decreased dopamine also. Decreased dopamine once again leads to hypersecretion of androgens. So in that way, nutshell, androgens will be more and will lead to PCOD. And ovulation. And ovulation is because of, once again, all these things play as a chain. So because of excessive androgens and more of LH, more of prolactin, the microenvironment of the follicle will be androgenic. And an androgenic microenvironment of the ovary or the follicle will not lead to ovulation. So when the microenvironment is androgenic, it will lead to anovulation, and anovulation will lead to the whole sequelae of PCOD. And one more thing, which is not least, but it's more important, that is weight gain or obesity. And obesity is often because of insulin resistance, and both of which will also play a role in PCOD. And PCOD, if it is not being treated, and all these 4 steps, that is hypothalamic pituitary correction is not being done, androgen excess correction is not being done, or anovulation is not being corrected, all these will lead to endometrial cancer, or it will lead to hyperlipidemia, which will in turn lead to cardiovascular diseases. And hyperinsulinemia insulin resistance and hyperinsulinemia will lead to diabetes mellitus, and in a very far sequelae, it can lead to sleep apnea. So in that way, PCOD needs to be treated at all these 4 levels. All these 4-level treatment has to be given when dealing with the case of PCOD. That is at the level of GnRH conversion or LH decrease, androgen decrease, and helping in ovulation from the ovary. So this is the diagrammatic representation of the same thing which I have said just now. This is the androgen cascade, how it is happening, how microenvironment of ovaries become androgenic, GnRH from pituitary, that will cause increased LH, then LH FSH ratio will be altered, and that will lead to androgen excess. This is once again the same cycle which goes on in the ovary, pituitary, hypothalamus, and also adrenals. This is the UNANI concept, which I'll come later on once I deal with the allopathic one. This is also once again UNANI concept. Symptoms, as everybody know, all the menstrual irregularities, hirsutism, unwanted hairs, acanthosis, hoarseness of voice, depression, and insomnia, hair fall, acne, etc. All these symptoms will be, not necessarily that all the symptoms will be present in each and every patient. Some of the symptoms will be present in some patient. So depending on those symptoms, one have to deal with the patient. Clinical features once again. These are the laboratory tests which can help us to reach to the diagnosis of PCOD, like FSH-LH, prolactin, testosterone levels, testosterone androstenedione or DHEA, or ultrasound findings, and 17-OPH or cortisol, SHBG, that is 6-hormone binding globulin, thyroid, fasting glucose, fasting insulin levels, fasting lipid profile, and not so important, or sometimes very often gynecologists miss the karyotyping. Very rarely, karyotyping can also be important. These are the complications or long-term sequelae of the PCOD. And PCOD often leads to the first and foremost popular thing, which is often met in all the gynecopedy, are infertility. But sometimes what happens, patients do not contact if they have completed their family. They feel, okay, no, I'm not getting periods. Okay, leave it off. But leaving it off at that point is not enough. And even the gynecologists sometimes, if they concentrate that you have completed your families, no issue if you don't get period, just no need of any treatment. Such a thing must not be born into anybody's mind, because PCOD is not going to affect only the menstrual cycle. It is having a systemic effect also. Systemic effect, like it will be having insulin resistance that will lead to diabetes mellitus. It will be having a lipid disturbances that will lead to cardiovascular ailments, cardiovascular disturbances, and hyperinsulinemia or insulin resistance will lead to metabolic syndrome, and the excessive androgens will lead to an excessive chronic estrogen excess will lead to breast cancer or otherwise endometrial cancer. So when we diagnose a case of PCOD, then we need to plan for a treatment. Treatment can be non-medical or medical. And medical treatment, many of the things, as everybody know in modern medicine, as well as in everybody's pathy. So while dealing with management, non-medical management comes first, that is weight control. For weight control, we can ask the patient to go for some aerobic and anaerobic exercises, and that can also be controlled by low carb diets. Low carb diets not only help in reduction of the calorie intake, calorie input into the body, but also it will help to stimulate the microbiota to help to control the chronic hyperestrogenism, so that it can affect the ovary to start ovulation. This microbiota if a patient intakes high carb diets, this microbiota will get irritated. And once this microbiota gets irritated, it will lead to the whole cascade to be in a reverse direction, wherein ovulation will be halted or androgenic environment will be seen. And management with medication, everybody know metformin will be given in modern medicine for hirsutism and acne, all the ciprofloxacin like or spironolactone, all these will be given. And to control the menstrual disturbance, OCPs will be given. For infertility, clomiphene citrate or drilling or reproductive techniques can be utilized. All these can be done in modern medicine. But as me being a Unani Unani gynecologist, I'll concentrate on the Unani point of view. In Unani point of view, we have the base on temperament. So when we say temperament will be we have 4 types of temperaments. Those temperaments are hot and dry, hot and moist, and cold and dry, cold and moist. So all these 4 temperaments will be seen in a normal physiological body. But in PCOD, the temperament of liver will change. Temperament of liver should be hot and dry, but here it will change to wet and moist. When the liver changes to wet and moist, all the functions of the body, most of the functions of the body will be taken care of liver. Liver is called as the main organ of the body as per Unani concept. So when liver is diseased or its temperament is changed, then shall I take a break? When the liver is
Ma'am, can we have the question back, ma'am?
Yeah, you can ask questions. Just
At the end, ma'am. Yes, ma'am.
10 minutes, we can.
Yes, ma'am. Please continue, ma'am. Ji, ma'am.
So when the liver is cold and moist, it will alter all the features of the body, all the functions of the body. That will bring about coldness in the ovary, and that ovary will malfunction and will lead to amenorrhea. When amenorrhea is being withstand for a longer period, it will lead to hirsutism and acne, and as well as melasma, acanthosis nigricans and all. And when the liver becomes cold and moist, it will not function. The metabolism will be slowed. And when the metabolism will slow, that will lead to obesity. So as per Unani literature or as per Unani concept, these are the things whichever we see in PCOS. So when these things are being seen, we need to control these through medication. And when we come to medication in Unani concept, we are having 4 types of treatment. One is regimental therapy, where we will be concentrating on weight loss, where there are exercises and many types of regimental therapies which will help in losing the weight. Then the next modality of treatment is dietotherapy. Dietotherapy is nothing but giving low carb diet, giving high protein diet, so that microbiota can increase, can improve, and lead to normal healing of the body. Pharmacotherapy, when we come to pharmacotherapy, there are many medication which can be given, and most of the medication whichever we give are opposite to the temperament of the disease. Like the disease is because of cold and moist temperature, so we'll be giving now here hot and dry medicine to cure the disease. And sometimes we use surgical method. Surgical method does not mean we don't do any surgery, drilling, oral drilling and all. We give cupping therapy, with which we let the blood, and while letting blood, we can decrease the obesity, and what we say is the temperament of liver and ovary has become cold and moist, and that cold and moistness will be reduced with the cupping therapy, and patient will start mensurating, ovulating, and she'll conceive with that procedure. Okay, this is the concept of medicine which we give in Unanipathy. That is the detonation, then purgative, then tonic medicine, which will help to recover the ovary and the liver and function normally. So that these are the things which I am not going in detail. So yeah, so now you are welcome to ask questions. Hello.
Yes, ma'am. Yes, ma'am.
Is there any question?
One second, ma'am. Yes, ma'am.
Yeah, let me know.
I hope. Yes, ma'am. I hope the session is too good, ma'am. Can we have the question and answer session now, ma'am?
Yeah, you can.
Yes, ma'am. Ma'am, the point over is how long the mentors are considered in Unani system, ma'am, regarding this PCOS of the women, because women will be going a lots of mental stress and all, according to the family issues also. So could we have a word on that, ma'am?
Yeah, mental stress can be reduced because this mental stress is because of change in the temperature, and at that point stress develop, the temperament change, it becomes dry. This dryness is created by using cold and moist medicine. What we say is essential medicine, and those medicines consist of and many more. The tulsi, rehan, all these medicines to combat. Is it clear?
Yes, yes, ma'am. Thank you, ma'am. Thank you so much. Any other question from the participants? They can ask them questions. Ma'am will answer the questions. Ma'am, what's the role of the diet also, ma'am, regarding as far as the woman's health is concerned? Could we have a note, ma'am?
Diet is much more important.
Mm.
As everyone, we are having some signs in the genital tract, as well as biota. They will be healthy things is provided to them. Like if you are having more foods, those refined and junk food irritate the microbiota. And once that microbiota is irritated, malfunction. Because of malfunction of that, it will lead to formation of decreased SHBG, and decreased SHBG once again will lead to hyperestrogenism or hyperandrogenism, and in turn lead to PCOD. So when we give low carb diet to the patient, that will help microbiota to improve, and that will be happy with the food low carb diet, and that will function normally, and what that normal function will lead to resolution of PCOD. That way, diet will help to the PCOD patient. Any other?
Yes, ma'am. Yes, ma'am. Ma'am, how about the role of like fertility in such women? Because as far as the PCOD is concerned, there was a note that many women suffering from the PCOS, they'll be suffering with infertility issues and all. So,
Infertility
hmm.
can be treated with
Yes, ma'am.
once ovary reach development function normal. Once it functions normally, it will start ovulating. Once ovulation, she will conceive.
Acha, acha. That is, we have to adjust the cycle ultimately.
Yeah, cycle.
Right to say.
For
Mm.
cycling will not be the ready-made. Instead of giving hormones, we will be correcting the ovary, stimulating the treat the hormone, and that activation of hormone in the ovary will lead to ovulation and pregnancy and all.
Acha, ma'am. Mm-hmm. Thank you, ma'am. Thank you for clearing us all the doubts also. Thank you so much, ma'am.
Thank you so much. Can I leave the meeting?
Yes, ma'am. 1 second, ma'am. We have a vote of thanks, ma'am. Just
Yeah.
after that. Any other question from the participants? They are welcome, actually. I hope they were clear with the topic, ma'am.
Okay, no
Right.
issue.
Yes, ma'am.
Thanks.
Is there any like link of like जैसे आपने बताया था कि what's the role of the link to liver and PCOS, ma'am?
Liver and the link is liver is sex hormone binding globulin the liver. This SHBG is absorbing estrogen which is unconjugated. This estrogen will be absorbed from the intestine in presence of SHBG. And SHBG will not be secreted. In that way,
Thank you so much, ma'am, for clearing. Thank you so much, ma'am, for the overwhelming session. Looking forward for many more and with many more topics regarding the UNANI system of medicine and various diseases also. And I hope the participants are also clear with their doubts also. And thank you, ma'am. Thank you so much, all the participants. And so we'll be back with the session soon. Thank you all. Thank you so much. Thank you, ma'am.